Hello my dear student. Today I am going to take up a topic on communicable and non-communicable diseases. Introduction. A communicable disease is defined as an illness that arises from transmission of an infectious agent or its toxic product from an infected person, animal or reservoir to a susceptible host, either directly or indirectly through an intermediate plant or animal host, vector or environment. Communicable diseases refers to diseases that can be transmitted and make people ill. They are caused by infective agents, that is pathogen, for example, bacteria and viruses, which invade the body and multiply or release toxins to cause damages to normal body cells and their functions. In severe cases, they may lead to death. These infective agents can spread from a source of infection, for example, patient, sick animals, to a person through various routes of transmission. Communicable diseases are a major cause of mortality and morbidity in coordination among the various agencies providing health care often coexist. The main causes of morbidity and mortality in emergencies are diarrheal diseases, acute respiratory infections, measles, and in areas where it is endemic, malaria. Other communicable diseases such as epidemic meningococcal diseases, tuberculosis, relapsing fever, and typhoid have also caused large epidemic among emergency affected population. Malnutrition and trauma are the two main additional causes of illness and death. Ensuring adequate shelter, water, sanitation, and food, and providing basic health care are the most effective means of protecting the health of those affected by emergencies. A systematic approach to the control of communicable disease is a key component of humanitarian response and is crucial to protect the health of affected populations. This requires cooperation among agencies working at local, national, and international levels, and collaboration among all sectors involved in the emergency response, that is health, food and nutrition, shelter, water, and sanitation. Apart from the infective agents, there are three other factors necessary for the occurrence of communicable diseases. Number one, source of infection. This refers to an environment in which infective agent can live, parasitize, and breed. It includes human, for example, patients, carrier, and people with latent infections, livestock, insect, and soil. The source of infection will normally form the basis for infective agents to infect human. Now we have mode of transmission. Mode of transmission is through various ways. It could be through direct or indirect contact, droplet transmission, airborne transmission, common vectors, for example, foodborne, waterborne, blood or body fluid transmission, and congenital infection. Number 3, host, that is susceptible population. Host refers to the susceptible population. Some people are more prone to become hosts. For instance, elderly with chronic diseases are more susceptible to infection as a result of weakened body immunity. Then we have types of communicable diseases. Communicable diseases are broadly classified into the following categories. Number 1, enteric diseases. Number 2, foodborne diseases. Number 3, waterborne diseases. Number 4, bloodborne pathogen diseases. Number 5, sexually transmitted diseases. Now we have enteric diseases. Enteric diseases are infections caused by the viruses and bacteria that enter the body through the mouth or intestinal system, primarily as a result of eating, drinking, and digesting contaminated food or liquids. Stomach pain, diarrhea, nausea, and vomiting are the typical side effects of enteric diseases. Now we have foodborne diseases. Foodborne disease is an infection or irritation of the gastrointestinal tract caused by food or beverages that contain harmful bacteria, parasite, viruses, or chemicals. Other foodborne diseases are essentially poisonings caused by toxins, chemicals contaminating the food. Common symptoms of foodborne illness include vomiting, diarrhea, abdominal pain, fever, and chills. After this, we have waterborne diseases. Waterborne diseases are those caused by drinking water contaminated by human or animal feces, which contain pathogenic microorganisms. Waterborne diseases like cholera, gastroenteritis, diarrhea erupt every year during summer and rainy season in India due to poor quality drinking water supply and sanitation. Number 4, blood-borne diseases. Blood-borne diseases include those caused by blood-borne pathogens. A blood-borne disease can be spread through contamination by blood and other body fluids. The most common examples are HIV, hepatitis B, hepatitis C, and viral hemorrhagic fevers. Now we have sexually transmitted diseases. Sexually transmitted diseases, so-called STDs, are caused by infections that are passed from one person to another during sexual contact. The organisms that cause sexually transmitted diseases may pass from person to person in blood, semen, or vaginal and other bodily fluids. Symptoms and signs of disease may include vaginal discharge, penile discharge, ulcer on or around the genital and pelvic pain. Now we have ways to minimize the spread of communicable disease. Number 1, encourage children and adults to wash their hands frequently, especially before handling or preparing foods and after wiping noses, diapering, or using toilets. Number 2, provide facial tissue throughout the facility and encourage both children and adults to cough or sneeze into the tissue. Regularly clean and sanitize all food service utensils, toys, and other items used by children. And after this, diapering and food preparation areas should be physically separated from one another, and their surfaces should be kept clean, uncluttered, and dry. And after this, next, discourage children and adults from sharing items such as combs, brushes, jackets, hats, and beddings. And lastly, wash bedding frequently. Now we have control of communicable diseases. Control of communicable diseases continues to be one of the highest public health priorities, both nationally and internationally. The aim of disease control programs, that is prevention and treatment, is to reduce excess morbidity and mortality by limiting the spread of diseases of epidemic potential. Proposed intervention will usually include adequate quantities of safe water, sanitation, nutritional services, reproductive health, food aids or food security, shelter and basic clinical care. There are a number of factors crucial to the spread of communicable diseases. They include the infective agent, the source of infection, the mode of transmission, and the host, the so-called chain of infection. Hence, the control of the spread of communicable diseases should focus on the controlling these four factors so as to break the chain. Now we have non-communicable diseases. Non-communicable diseases, so-called NCDs, are those diseases which cannot be transmitted from one person to another. NCDs can refer to chronic diseases which last for long period of time and progress slowly. This is mainly due to demographic transition and changing lifestyle of population associated with urbanization. Chronic non-communicable diseases are largely due to preventable and modifiable risk factors such as high blood cholesterol, high blood pressure, obesity, physical inactivity, unhealthy diet, tobacco use, and inappropriate use of alcohol. Type of non-communicable diseases. Non-communicable diseases are classified into the following 7 categories. Number 1, cardiovascular disease. Number 2, cancer. Number 3, chronic respiratory disease. Number 4, diabetes. Number 5, chronic neurologic disorders. Number 6, musculoskeletal diseases. Number 7, unintentional injuries. Now we have number 1, cardiovascular disease. Cardiovascular disease is a group of disorders of the heart and blood vessels and may include coronary heart disease, disease of the blood vessels supplying the heart muscles, and cerebrovascular disease, disease of blood vessels supplying the brain. Peripheral arterial disease, that is disease of blood vessels supplying the arms, the legs. Congenital heart disease, that is malformation of heart structure existing at birth. Now we have cancer. Cancer is a generic term for a large group of diseases that can affect any part of the body. Cancer is a rapid creation of abnormal cells that grow beyond their usual boundaries and which can then invade adjoining part of the body and spread to other organs. There are different types of cancer occurring in various parts of the body: cervical cancer, lung cancer, breast cancer, prostate cancer, colorectal cancer, mouth cancer, stomach cancer, blood cancer, etc. After this, we have chronic respiratory disease. Chronic respiratory diseases are chronic diseases of the airway and other structures of the lungs. It is caused due to many risk factors, that is cigarette smoking, occupational dust and chemicals, environmental tobacco smoke, indoor and outdoor air pollution. It includes chronic obstructive pulmonary disease like bronchitis and emphysema, asthma, occupational lungs diseases and pulmonary hypertension. Now we have diabetes. Diabetes is a metabolic disease in which the person has high blood glucose, that is blood sugar, either because insulin production is inadequate or because the body cells do not respond properly to insulin, or both. There are 4 types of diabetes: type 1, type 2, gestational and pre-diabetes, that is impaired glucose tolerance. Type 1 diabetes, the body does not produce insulin while in type 2 diabetes, the body does not produce enough insulin for proper function. Type 2 is caused by modifiable risk factors and is the most common worldwide. Greater than 90% of all adult diabetes cases are type 2. Healthy diet, regular physical activities, maintaining a normal body weight and avoiding tobacco use can prevent or delay the onset of type 2 diabetes. The most common diabetes symptoms include frequent urination, intense thirst and hunger, weight gain, unusual weight loss, fatigue, cut and bruises that do not heal, male sexual dysfunction, numbness and tingling in hand and feet. Now we have chronic neurologic disorder. Chronic neurological disorder is any disorder of the body nervous system. The specific causes of neurological problem vary, but can include genetic disorders, congenital abnormalities or disorders, infections, lifestyle or environmental health problems, including malnutrition and brain injury, spinal cord injury or nerves injury. Symptoms mainly include paralysis, muscle weakness, poor coordination, loss of sensation, seizures, confusion, pain and altered level of consciousness. Now we have musculoskeletal diseases. Musculoskeletal disorder, so-called MSD, are injuries or pain in the body's joint, ligament, muscle, nerves, tendon and structure that support limbs, neck and back. Muscle tissue can be damaged with the wear and tear of daily activities. Trauma to an area also can cause musculoskeletal pain. Other causes of pain include postural strain, repetitive movement, overuse and prolonged immobilization. Symptoms of MSD vary from person to person, but the common symptoms are pain, fatigue and sleep disturbances. Common MSDs are arthritis, osteoporosis, osteomalacia, tendonitis, bursitis, muscular dystrophy, etc. Now we have unintentional injuries. Unintentional injuries refer to injury that were unplanned. Unintentional injuries include only those injuries that occur without intent of harm. Such injuries are frequently called accident. Unintentional injuries can occur in any age group, but children and the elderly are more vulnerable. Disability can result from many types of accidents, including motor vehicle accident, drug overdoses, falls or fires. The chances of recovery depends on the type and severity of the injury. After this, we have control of non-communicable diseases. So-called NCDs can be controlled by reducing the behavioral risk factor, thereby reducing the probability of the disease. World Health Organization has prioritized 4 different risk factors. They are physical inactivity, that is, most of the world's population does not get enough physical activity due to various social and economic changes. Tobacco use. Tobacco kills up to half of its users. And unhealthy diet, that is, increased fat and sodium with low fruit and vegetable intake. Overall daily consumption of unhealthy diets like fat, meat and nutrient-poor food have increased in most countries, leading to serious health effects. We can conclude this present topic in the following manner. Communicable diseases are a major cause of mortality and morbidity. A systematic approach to the control of communicable diseases is a key component to protect the health of affected populations. Control of communicable diseases should focus on controlling the 4 factors, viz. The infective agent, the source of infection, the mode of transmission, and the host. It will also include adequate quantities of safe water, sanitation, nutritional services, reproductive health and food security, shelter, and basic clinical care. Non-communicable diseases can be controlled by reducing the behavioral risk factor, thereby reducing the probability of the disease. Overall daily consumption of unhealthy diets like fat, meat, and nutrient-poor food should be avoided. With this conclusion, I would like to wind up the present topic on communicable and non-communicable diseases. Thank you very much.